talk about NN blockers. The mechanism of action is block nerve impulse transmission in autonomic ganglia, both sympathetic and parasympathetic system. There are two types, quaternary amines and tertiary amines. The difference between quaternary amines and tertiary amine, quaternary amine is soluble, so it cross blood brain barrier, and it is could be used for malignant hypertension. So there are these are the drugs, hexamethonium, trimethonium. So trimethonium usually used in malignant hypertension due to this quaternary amine. Quaternary amine is soluble, so it is cross blood brain barrier, and it is centrally acting. And tertiary amine doesn't do that. It is mecamelamine is the drug for tertiary amines. Indications for ganglionic blockers is hypertensive crisis, so you could use trimethonium. Next, you could use pulmonary edema and cerebral edema with high blood pressure. For those indications also you could use ganglionic blockers. Side effects of postural hypotension and constipation and urinary retention. In contraindicated, they are in severe renal insufficiency, coronary insufficiency, and retinal and cerebral thrombosis. So when we are talking about NN receptors, necessary to talk about nicotine and smoking. So smoking, when you're talking, its main component is nicotine. No? So you have to know what is the toxicology of nicotine. Why this nicotine is bad? So nicotine is bad due to addiction. There's a dopaminergic system that could be addicted, same as other unhealthy diets or healthy diet. The dopaminergic system, what does it do? It will give pleasure when you are doing something. It means uh, it is actually, this system is developed evolutionary. Okay, all right. So uh, in when you're hungry, so these system know that when you get food into your stomach, it will be dopamine will be released. So you need that dopamine pulse to happen. Nicotine same way, but the difference between food and nicotine is the food is good, no, it's for the hunger, but nicotine is not need. Nicotine is of course need, but to know it to be addicted, it is not good. So it will increase heart rate and blood pressure, increase heart rate and blood pressure. Very where we talk about hypertension, atherosclerosis, and every time we talked, smoking is a risk factor. So increase heart rate and blood pressure, and increase LDL and VLDL level, and increase high level high risk of atherosclerosis. So this is very important, we know. So the LDL and VLDL is most oxidized in the atherosclerotic plaque. So HDL is good, LDL is bad. So that's why we can't use actually that is why smoking is not good. And neoplasm. So there are various reasons that nicotine is not good for neoplasm, because when neoplasm is happening is because the cells DNA RNA are getting damaged, and they can't be repaired reversibly. So it will form a clone, and it will grow as a neoplastic tumor. So that's what happens when you smoke, due to not only due to nicotine, also due to the carbon monoxide and every gas that you are inhaling into your lungs. So there will be risk of free radical formation. Free radical will damage your DNA and RNA, and free radical O2 minus and OH minus, like those radicals. That's why nicotine is not good. That is a toxicology of nicotine. So withdrawing smoking could be aided by, there is nicotinic patches, transdermal nicotinic patches. We call this nicoderms, and could use varenicline as well. Those are available in pharmacies if you want to quit smoking. So there are the things about NN blockers. Mainly, you have to know the toxicology of nicotine, and this trimethonium. What is the difference between quaternary amine, tertiary amine, and what when are these indicated? So it's mainly in the malignant hypertension. Trimethonium we use the quaternary amine due to close in blood-brain barrier. So next is neuromuscular blockers. This is very important. So there are two types: non-depolarizing neuromuscular blockers and depolarizing neuromuscular blockers. Mechanism of action of non-depolarizing ones are compete with acetylcholine and bind with receptors and prevent binding of acetylcholine. So what is this basically does is it will relax muscle. Examples are tuberculin, pancuronium, atracurium, vicuronium, rocuronium, cis atracurium. So in here, indications are more important. All right. So indication we use as pre-anesthetic medication for muscle reduction before surgeries and facilitate endotracheal intubation and esophagoscopy, bronchoscopy, laryngoscopy to facilitate. So if someone asks what drug you use before bronchoscopic examination, you could say rocuronium, cisatracurium, vicuronium, because they relax smooth muscle and it will facilitate those um, uh, cameras go inside your bronchus or the respected part you are going to see. So basically in esophagogastroduodenoscopy, when you are doing it, you have to use this drug to relax smooth muscle. So those instrument will pass through esophagus very easily. It will facilitate it because it is relaxed, it is mean dilated. Okay, so those, that is why these non-depolarizing news must will, because just you have remember esophagogastroduodenoscopy to relax the smooth muscles in esophagus. And what is the mechanism of action? Compete with acetylcholine and bind with NM receptors and prevent binding of acetylcholine. Okay, so next the depolarizing one. Depolarizing means they are non-competitive. Non-depolarizing, they are competitive, they compete with acetylcholine. Depolarizing, they're non-competitive, they do not compete with acetylcholine, hence bind with nicotine receptors that but cannot be degraded by acetylcholinesterase. So they are cannot be degraded by acetylcholinesterase. So examples are succinylcholine, succinylmethonium, dicamethonium. So side effects is malignant hypothermia, increased temperature, tachycardia, and acidosis. Those are the basic thing of anticholinergic drugs. In anticholinergic drugs, we have to know what is atropine poisoning, um, and what drugs that we are going to use before esophagogastroduodenoscopy or bronchoscopy or laryngoscopy or as pre-anesthetic medication on depression muscle, because for muscle relaxation it will aid the surgeon to do incisions or everywhere he wants to do, or when we are doing esophagogastroduodenoscopy or bronchoscopy or laryngoscopy.